In this week's health headlines, if you suffer from seasonal allergies, you're probably not too excited that spring is here. We have some tips for you that might help you feel better this year. According to the Centers for Disease Control and Prevention, more than 50 million Americans suffer from allergies, and many of those allergies are considered seasonal. In the spring, if you're one of the millions that go through this every year, there are a few things you can do to ease the discomfort. Check the pollen count in your area when the pollen is high. Limit your exposure by staying inside and keeping windows closed. Change out the air filters in your home frequently and make sure you are using HEPA filters. Wash your hair before going to bed, and if you've been doing things outside, toss those clothes in the laundry when you come back in. And don't forget to talk to your doctor about taking a daily allergy medication, including a nasal spray. Young people on amphetamines for treatment with attention deficit hyperactivity disorder, or ADHD, have a higher risk of developing psychosis. That's according to a new large study at Harvard Medical School. The study followed more than 221,000 teens and young adults ages 13 to 25 who were recently prescribed stimulants like Adderall or Ritalin for treatment. The results showed a rare risk of psychosis in the first few months after starting on the medication, and it was twice as high for those taking an amphetamine, such as Adderall, compared to those taking methylphenidate stimulants, such as Ritalin. And for the first time ever, the FDA has announced its approval of a drug to treat postpartum depression. The drug is called Zulresso. It's an intravenous infusion of brexanolone, administered as a single 60-hour IV drip. Postpartum depression affects an estimated 1 in 9 new mothers after childbirth. Without treatment, symptoms can last for months or years. In the past, treatment options have included counseling and antidepressants, but antidepressants can take weeks to have an effect. In clinical trials, Zulresso has been shown to take effect within hours of the infusion.